Rhode Island is now adopting a new way to categorize COVID-19 risk levels in the state. This follows the CDC's changes. Counties will be included in the state's daily data on a tiered system, and this will apply to how kids will have to quarantine in their child care settings. 12 News reporter Anita Buffoni joins us now live with the new details. Anita?
Hi, Kim. Well, Rhode Island will now track COVID-19 data based on low, medium, and high risk levels, and this new approach will now change how children have to quarantine in child care settings. For the Boys and Girls Club of Warwick, the new tiered system to measure COVID-19 risk is a welcome change.
I think it's going to keep our kids and our staff safe.
The tiered system mimics what the CDC is now doing, using hospital metrics and case counts to determine if a county is in low, medium, or high risk for COVID-19. Rhode Island is currently considered to be in the low risk category.
One thing this pandemic has taught us is to expect the unexpected. But the way that we're moving towards is a good thing. It's going to help us prepare for these variants.
This applies to how kids will have to quarantine if exposed to someone with COVID-19. The lower the risk, the less strict the quarantine rules will be. These changes going into effect March 14th.
Alternative quarantine approaches for childcare have proven effective in neighboring states, and we're confident they will be effective in Rhode Island for Rhode Island families as well.
This tier system also applies to mask recommendations. Low-risk counties, there are no masking recommendations by the Department of Health. Medium risk, the DOH says to talk to your doctor and consider a face covering. And high risk, masking indoors is recommended. For the Boys and Girls Club, this change on top of the mask mandate ending will help the kids interact better with their peers.
The kids can socialize better now because we can be more flexible in our programming.
Now, Governor Dan McKee announced following the change on the federal level, students will no longer need to wear masks on school buses. He's leaving it up to school districts to decide. In Providence, I'm Anita Buffoni, 12 News.
Governor Dan McKee says Rhode Island will adopt a new tiered system for measuring community-level risk for COVID-19.
This is following the CDC's updated guidance. There are also changes to how children quarantine if exposed to COVID to help them stay in child care settings.
12 News reporter Anita Buffoni was at today's COVID-19 briefing. She joins us now from the State House with the details. Anita?
Well, this change will categorize Rhode Island's counties by risk levels, low, medium, and high. And this new tiered system will also impact how kids have to quarantine, something some child care centers say is a welcome change. Rhode Island is continuing to build upon its endemic strategy. The state has updated quarantine recommendations to allow children to remain in care.
We want to provide a new approach that will continue to ensure safe access to care while addressing the disruption to families' lives.
Rhode Island is adopting a new tool to help communities decide what prevention steps to take. Data will now be reported by county.
New system looks at risk levels using low, medium, and high tiers, and it tells what steps you need to take in order to keep yourself, your family, and others around you safe and healthy.
The steps applies to quarantine rules for children and staff in child care settings. A test to stay approach will be in place for communities in the high category and a monitor to stay method in communities with low spread. Laura D'Antuano runs the Warwick Boys and Girls Club. She says the change coupled with the mask mandate ending will help children stay engaged and together with their peers.
This allows us to have flexibility. It gives the kids more choice.
The tier system also applies to mask recommendations. In low-risk counties, there are no masking recommendations. Medium risk, Department of Health says to talk to your doctor and consider a face covering. And high risk, masking indoors is recommended. Currently, Rhode Island is considered to be in the low-risk category. All of these changes go into effect March 14th. In Providence, I'm Anita Buffoni, 12 News.